role of a leader is to prioritize what really matters. There is so much bureaucracy and minutia and expectations of big government that pull leaders in directions that don't have a direct impact on your ambulance service or your people.
Joe Acker has spent 35 years running emergency medical services across Australia and Canada, and now is our foundation's CEO. In this episode, he explores EMS leadership culture, why leading with love and high standards aren't in conflict, and how leaders can protect their service without becoming an island.
You often talk about, leadership with love, leadership that's people focused. Is that something that's taking over? Is that something that's new, or is that something that's always been there? How do you see the leadership generally for EMS?
It's a great question. I think in places like Australia and Canada, the United Kingdom, there are some organizational cultural challenges right now. You'll see online and then read in the media that ambulance services are broken, that the culture's terrible, the culture's toxic. I don't necessarily believe that's true. I think that organizations are, and the leaders of organizations are absolutely doing the best they can with the resources they have. But I think the expectation of the workforce, the public, the systems, the leaders themselves has changed. It's a place where what we've done in the past doesn't necessarily work anymore in ambulance services. We generally, in countries around the world, came out of like the fire service or the military. We were paramilitary kind of emergency services responders. And we still have retained some of that culture and certainly a lot of those traditions and a lot of those values. And we've brought that into an environment that is now different. It's more about providing healthcare. It's providing primary care. It's less about hierarchy and paramilitary structure. And that means that we have to change the culture, and leaders need to be very open to making changes in their organizations, very open to hearing from their people of what they need. And we do hear about like leading with love and, the leaders caring more about their people because quite frankly, new graduates, new people entering the field, that's what they're demanding. They want a leader that cares for them. At the same time, we have to hold people to high standards because the community and our bosses, the governments, want us to perform at a high standard. So it's a matrix of deep devotion to our people and maintaining high standards. And you can maintain high standards while also caring for your people. And that is the challenge of pre-hospital leadership right now. It's creating a high performance system that delivers on our commitments to our community while also showing our people we care about them in a very difficult environment. We have busy systems. We have ambulance services that are performing at such a high level that caring for those people in the systems is difficult. And there's things we can't control. We can't control the hospital wait times and offload delays at hospitals that drive people crazy. We can't easily control the end of shift overtime that makes everybody crazy. And we can't control the patient population that is increasingly more challenging, more comorbidities, more violent. And that is all stressful for people working in these systems. It's a very difficult chart for management. And
So what's the Joe Acker solution for that balance, the balance between standards and the leadership with love? How did you match that together? What's your technique?
Well, I don't think I'm necessarily the best example. Certainly, we all try to be the best at providing the best leadership for organizations. I think leaders have to show up. We have to show our people that we're there with them, that we understand their work environment. We get in their work environment to support them, and we take back lessons from the work environment that we can make changes on. I think we have to communicate what's happening, what we can do, what we can't do, and being honest and transparent with people. My leadership style was about being transparent, committing to the things I could control, but calling out the things that I can't control. So to manage expectations. The role of a leader is to prioritize what really matters. There's so much bureaucracy and minutia and expectations of big government that pull leaders in directions that don't have a direct impact on your ambulance service or your people. And those leaders are needing to be very protective of their time so that they're applying their time and their energy in the right places. And I think we sometimes lose focus on that. We get pulled in a direction of big government and bureaucracy and administration that takes us away from taking care of our people and holding our systems accountable. Part of the important part of leadership is working on all levels of leadership. And the frontline providers often are frustrated with their supervisors, and the supervisors frustrated with their managers who don't make decisions. As a senior executive leader, you have to work across all of those levels to ensure that everybody's needs are being met, everybody is being held accountable to a standard that everybody knows, and that you're demonstrating you care about every level. And that's really important.
Yeah, I guess it's a way of being protective of your service against all these influences. Would that be
Yeah.
the right way to view it?
As leaders, we have to be protective of our service. We have to be protective of our people. We have to advocate for our people, but we cannot be an island. Leaders of ambulance service or any emergency service or health service that tries to be an island independent of everybody else will fail because we can't. It's critical that we are working across our partnerships and across our networks. We have to have strong relationships with our hospitals. We have to have strong relationships with our fire services and first responders. We have to have strong relationships with our governments and our ministries. So as executive leaders, we have to spend time keeping those relationships strong. But at the same time, I think we have to say, no, we're not going to sit on that committee. We don't have capacity to do that. Or no, we're not going to participate in this function, this event, because we have other priorities that we need to focus on. And sometimes those are difficult decisions to make, difficult conversations to have. So it is about juggling a lot of balls at the same time. And we don't always get it right. And that's okay. Learning from some of our mistakes, learning from some of our missteps is really important as leaders.
Thank you for listening to Before the Hospital. Available wherever you get your podcasts. Produced by EMS Global Foundation.